Hi everyone, my name is Emma, and I decided to do my project on ketamine for treating PTSD. So PTSD, or post-traumatic stress disorder, is a serious and often life-altering mental health condition that affects millions of people worldwide. It is normal for people to experience stressful and traumatic events in life, and most people exposed don't develop PTSD. However, according to the World Health Organization, an estimated 3.9% of the population has PTSD at some point in their lives. And if we have about roughly 8.1 billion people in this world, it comes out to almost like 315 million people, which is still a lot of people. Whether military veterans or survivors of abuse or accidents or natural disasters, PTSD can disrupt a person's daily life, their relationships, their work, and their overall well-being. There is traditional treatments available like therapies and antidepressants, and even acupuncture works. But a lot of people still have a hard time finding enough relief, which leaves them in a constant cycle of distress and dysfunction. But there is one treatment that seems promising, and it's ketamine. It's a dissociative anesthetic, and its fast-acting ability to reduce symptoms of like anxiety and depression could be a good way of treating patients with PTSD. So, post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after a person experiences or witnesses a traumatic event. There are plenty of people that PTSD can affect, and most of the time it's like people who have more mentally taxing or distressing lines of work, like people who have served in wars, like military or Navy, air personnel, even space services and first responders a lot. Other people who can be seen with PTSD symptoms are like survivors of abuse or assault, people that have been in serious accidents or natural disasters, people with pre-existing mental health disorders or history of trauma. These events can impact anybody. It will impact like your daily life, your school, your work, relationships, emotional functions, performance, and just overall like your quality of life. Um, this type of mental stress often leaves individuals feeling stuck in fear and hypervigilant long after the event has occurred, especially if it's not treated quickly or properly. There are a lot of symptoms of PTSD as well, and they can range from reoccurring, involuntary, and intrusive memories or thoughts of the event, distressing dreams like nightmares involving the event, dissociative reactions like flashbacks where the individual acts or feels like the event is still reoccurring, psychological distress, persistent avoidance. So, for example, if you were in a car crash, you don't want to be in the car, you don't want to be on the road, you don't want to be driving, you don't like being around cars and stuff like that. And there's many other symptoms, but those are your more like prominent ones. And the symptoms have to be persistent for at least a month after the event has occurred to be considered PTSD. Current treatments for PTSD include different types of psychotherapies like cognitive behavioral therapy, exposure therapy, EMDR, which is eye movement desensitization and reprocessing therapy, FDA-approved medications like SSRIs, like Zoloft or Paxil, support groups, and even acupuncture have been used to help manage these symptoms, but unfortunately sometimes individuals don't respond to these treatments or they have trouble following them. While some treatments may work for a select few, not all techniques are universally successful, which is where new treatments like ketamine have been explored, and so far they show promise in patients. So, ketamine is a treatment that was originally used as a dissociative anesthetic in both human and vet medicine back in like the 1960s. It was recently FDA approved back in like 2019, which is a considerably long time. And over the years, this drug has gained its popularity for its potential use for other treatments like treating other mental health disorders like depression and anxiety and PTSD. So, unlike traditional antidepressants that aim to improve a person's serotonin and norepinephrine levels, ketamine works on restructuring the brain's glutamate system. Glutamate is an amino acid within the brain's central nervous system that acts as an excitatory neurotransmitter. Transmitters are programmed to send chemical messages from one nerve cell to the next, and then so on throughout the body, like to your targeted areas. Glutamate responds to ketamine by blocking out NMDAs, which is a type of glutamate receptor in the brain, and these are crucial for a person's learning and their memory and other like neural communication abilities. The technique helps increase the brain's ability to adapt and change at a molecular level and like a structural level in response to like other like pathological conditions. The effect can lead to rapid relief and sufficient improvements in one's mood and emotional regulation, and the ability to work quickly has made symptoms extremely better for like people that are taking ketamine. It's especially valuable for those who have experienced like extremely traumatic events or crises, or those who haven't found relief yet in previous traditional treatments. It works differently from like normal antidepressants and mood stabilizers and stimulants. Like those treatments can take up to several weeks to take effect, if there is any effect at all, and ketamine may only take up to like a few days to a few hours, and that's why this type of medication is so promising in those who experience PTSD, because it targets the NMDA receptors and influences the brain's glutamate system. It promotes synaptic plasticity, which essentially helps the brain kind of rewire itself after it experiences a traumatic event. PTSD is associated with changes in the brain and the frontal lobe, which is known for like the cognitive and behavioral functions. Temporal lobe, which is known for processing information and memory and perception and feelings. Areas like the amygdala, which is associated with like fearful emotions. The hippocampus, which is known for like a person's memory abilities, and then the prefrontal cortex, where it's responsible for like your decision making and your emotional regulation, all play a part in how PTSD affects somebody. And with the use of ketamine in these areas, it helps to restore these functions by making it easier to process and understand like the memories of the event, and then to regulate your emotional responses. Ketamine can be administered through injection, whether that's through an IV or to a shot in the muscle, or it can be used as a nasal spray, all of which I think would be very uncomfortable because I don't like that stuff. And it's often combined with a ketamine-assisted psychotherapy, which is known as CAP. It's clinically offered in low doses over like a series of sessions, and is often paired with the psychotherapy. This combination is used to help deepen the experience of the therapy, which kind of makes patients feel more open and emotionally connected, and they're able to explore their traumatic event with like less fear and distress. And while ketamine is not a cure for PTSD, it can help create a window of relief for patients, making therapy much more effective for them, especially for those who have struggled with their other traditional approaches. Just like anything else, it does not come without its limits. While ketamine does show great potential in treating PTSD, its usage does not come without risk. Just like any drug, there's always the potential for misuse or psychological dependence, because it's known as a dissociative anesthetic, which is a type of subclass of psychedelic drugs that induces like the sense of, being like dissociative. It could be addictive. For example, if a person feels detached like from their thoughts and their feelings or their body and surroundings, they can be exposed to hallucinations or enter like dreamy like states. They can experience amnesia, and it could have a lot of other effects. Being, like I said, that it's a dissociative anesthetic, its recreational use was often referred to as Special K, and it's been associated with substance abuse, of course. In clinical environments, ketamine is administered carefully in like monitored microdoses, but its rapid feel-good effects can make it just as addictive as any other dopamine-increasing stimulant. This is why this type of treatment, especially like concerning people of vulnerable populations, like those with traumatic histories or who already struggle with addiction or impulsivity, this probably isn't something for them. And although it's not as addictive in the same way that opioids are, there's always still the risk of like a psychological dependence. And if protocols are not followed, or if patients attempt to self-medicate outside of supervision, the chance of addiction is much greater. here are all 4 of the references that I used like throughout my presentation if anybody was interested. And that is the end. Thank you guys for watching and listening to my presentation. I hope you all enjoyed it.